Western Australia leads the rest of the nation in lots of things. We've got the strongest economy, we're the biggest state, and we have the fastest growing population. But we've also racked up another record. We're currently leading the states in rates of chlamydia, and sometimes coming first isn't everything. The figures are not good. New cases of chlamydia have more than tripled in the last decade. It's estimated something like 1 in 5 people under the age of 30 now has the infection. And the worst bit is about 80% of them aren't even aware they have it, meaning they could be passing it on to others without even knowing.
Chlamydia is serious. It can make you infertile, it makes HIV easy to catch and spread, and it can even lead to ectopic pregnancy, which can be fatal.
The good news is, chlamydia is easy and cheap to treat if young people are actually tested for it. But the stats show they're not. Even though about 85% of girls and 65% of guys under 30 go to a GP once a year, only 8 or 9% of them are actually tested for STIs.
I work for the YACWA project and we try to educate young people about sexually transmissible infections. They're telling me they're embarrassed to talk about STIs and that they don't have anywhere to go and get tested without being judged.
And the bad news doesn't even stop with chlamydia. Figures show WA also leads the states in rates of gonorrhea, which have tripled over the past decade, and HIV is also on the way up.
We at the Youth Affairs Council of WA want politicians and the public to stop sticking their heads in the sand when it comes to educating young people about STIs. Research shows when young people are given a proper education about their sexual health, they're likely to start having sex later, have less sexual partners and use condoms.
So what does YACWA actually want? Well, firstly, they think sex ed should be mandatory in all schools in WA. At the moment, there is a federal curriculum in place, but schools don't have to implement it, meaning kids at some schools get some sex ed and others get none at all. Secondly, YACWA wants young people to be able to access health services that are specifically designed to meet their needs, so they can get accurate, well-balanced info about STIs and get tested without being given the third degree. YACWA thinks there's a particular need for services in the northern suburbs and regional WA.
I think young people would be more likely to get tested for STIs if they had somewhere to go that was easy to access and they didn't have to tell anyone.
So whether you're a parent, politician, youth worker or teacher, we've all got to work together to make sure young people get the education about sex they need. Because for WA, sometimes coming first isn't everything.